I'm Brooke Taylor. I'm a nursing student at Georgia Baptist College of Nursing. This is my head-to-toe assessment, and my lab faculty is Dr. Forrest.
I'm Jacqueline Jansen, and I give my consent for this to be filmed and reviewed by Mercer faculty.
Great. Okay, I am in appropriate PPE. I wash my hands. I make sure I have all my supplies. I've organized them at the patient's bedside. I'm going to don clean gloves. I make sure that the brakes of the bed are on. I'm going to raise the bed to a comfortable working height. I am also going to position the patient properly. Great. Hi, my name is Brooke, and I'm the nursing student that's going to be caring for you today.
Hey Brooke.
Can you please state your name and date of birth?
Jacqueline Jansen, 3/22/95.
Wonderful. So nice to see you today.
You too.
I am going to be performing a head-to-toe assessment on you.
Okay.
I'll be explaining what I'm doing throughout the entire procedure.
Okay.
I'm also going to maintain privacy throughout this entire procedure, and anything that I learned today will only be shared with the members of your healthcare team and otherwise considered confidential.
Okay.
Okay? So, the patient appears stated age. Her grooming is good, her hygiene is good, and she's dressed appropriately. She doesn't appear to be in any distress. She appears to be comfortable. Her body build, her weight and height are all proportional. Her posture is proper. Best posture. And yeah, so Miss Jansen.
Yes.
How are you doing today?
Doing well.
Wonderful. Can you tell me what you had for breakfast this morning?
I had bacon.
Great. Can you tell me what year it is?
2020.
It sure is. Not much longer.
No.
Patient displayed immediate, remote, and recent memory very well. Miss Jansen, can you tell us where we are right now?
We're in Brooke's room.
Yes, we sure are. And can you tell me the day of the week?
Wednesday.
It sure is Wednesday, isn't it?
Mm-hmm.
Whew, can't wait for Friday. Patient is alert and oriented to person, place, and time.
Cool.
You are looking good, Miss Jansen, today. So, observing the patient's facial expression, nonverbal cues, and posture, she doesn't appear to be in any pain. Miss Jansen,
Yes.
are you experiencing any pain?
I am in pain.
Oh, I am so sorry. Where's your pain located?
It's in my right knee.
Oh dear. Can you please tell me when this pain started?
Like 4 days ago?
Oh, 4 days of pain. And does it radiate?
No.
What alleviates it or aggravates it?
Pain medicine helps. Standing on it makes it worse.
And you want to describe that pain for me?
It's like a piercing pain.
Oh, my dear. And if you were to rate it on a scale of 0 to 10, 0 being not painful, 10 being very painful, what would you rate it?
Like a 4.
Oh, man. Okay, we will get to that as soon as we are done with your head-to-toe assessment, okay?
Okay.
Wonderful. So now I am going to check your neuro status,
Okay.
that little brain of yours. So, assessing cranial nerves 3, 4, and 6. I'm going to look at your eyelids. There appears to be no swelling, no ptosis, no drooping. Your sclera is nice and pearly white and no discoloration. Now I'm going to shine the pen light in your eyes. I'll be testing cranial nerves 3, 4, and 6. So just look at my
Okay.
light, okay?
Okay.
Look at me, not the light, silly me. Wonderful. So the patient, her pupils are equal, round, reactive to light, and accommodating. Now, testing cranial nerves 3, 4, and 6. One more time. We're going to do the 6 fields of gaze, okay?
Okay.
So just look at my pen light, follow with your eyes,
Okay.
and don't move your head. Okay? Wonderful. You are just a pro, Miss Jansen. Yes. So the patient's eyes, 6 fields of gaze intact, and they converged wonderfully. So now I'm going to inspect Miss Jansen's nasal mucosa. If you could please tilt your head back. Wonderful. Your nasal mucosa is pink without lesions or drainage. And now for your lips and your oral mucosa. The lips are a wonderful pink color. They look nice and moist, nice and hydrated. Can you please open your mouth for me, Miss Jansen? Great. The oral mucosa is moist, pink, free of sores, lesions, or tumors. Now, assessing cranial nerves 9 and 10, I am going to have you open your mouth and say, ah. That was great. Ah. Your uvula rises and falls and is not swollen.
Cool.
Your throat, no redness, no lesions, doing great. If you could, please swallow. That was great. So testing cranial nerve 9 and 10, her swallow reflex is perfect and normal. So now testing one more cranial nerve, number 12. I'm going to have you stick out your tongue and move it side to side. Great. And can you please say light, bright, dynamite?
Light, bright, dynamite.
Ooh, cranial nerve 12. Really working well. So now I'm going to assess your respiratory status. So, are you having any difficulty breathing, chest pain, chest tightness?
No.
Shortness of breath?
No.
Good. I am going to count your respiratory rate and rhythm now for a minute. Okay. Okay, Miss Jansen, your respiratory rate is 18 breaths per minute. Your respirations are unlabored, they're steady, and regular.
Cool.
You're not using any nasal flaring, accessory muscles when you breathe, which is a great sign. So now I'm going to listen to your breath sounds posteriorly and anteriorly. Anteriorly first. Okay. Please sit up straight. Thank you. Wonderful. Now I'm going to listen posteriorly. If you could please turn around.
Okay.
It's okay. Wonderful. Those lungs are working so well. You can lay back down for me.
Okay.
Breath sounds are vesicular, no adventitious sounds.
Cool.
So now I'm going to listen to your heart.
Okay.
So I'm going to start with the aortic valve.
Okay.
That is at the right sternal border, second intercostal space. I'm listening with my diaphragm. Next is the pulmonic, which is at the left sternal border, second intercostal space. Next is the tricuspid valve, left sternal border, fourth intercostal space. And lastly is the mitral valve, which is at the fifth intercostal space, left mid-clavicular line. Here I'm going to assess the apical pulse, right in rhythm, for 1 full minute. Apical pulse rate is 78 beats per minute. Pulse strength is 2+ and normal. I heard no lifts or heaves, and I did hear S1 and S2. Now I'm going to listen to all those valves one more time with the bell. So the mitral first. Next is the tricuspid. The pulmonic. And then lastly, the aortic. Great, your heart sounds good. It's pumping right. So now I am going to observe your abdomen. It is flat, symmetrical. There's no distension, no abnormalities, no markings, no protrusions. Looking good. So now I'm going to auscultate your bowel sounds, okay?
Okay.
I'm going to start in the right lower quadrant.
Okay.
I'm going to move clockwise, and I'm going to listen in each quadrant for 1 minute. Now, the right upper quadrant. Now, the left upper quadrant. Now, the left lower quadrant. Those bowels are moving. All quadrants had vowel sounds present. If there were not vowel sounds present, I would listen in each quadrant for 5 full minutes. Yeah.
Okay.
So now I'm going to lightly palpate.
Okay.
Vowels are funny. I'm going to lightly palpate. If you could, please let me know if there's any pain or tenderness.
Okay.
Did you feel any pain or tenderness,
No.
Miss Jansen? Great. So your bowels, how frequently are you having bowel movements?
Like twice a day.
Okay. And what is the color and the consistency?
Brown and it's solid.
Oh, okay. And any diarrhea, any constipation?
No.
Great. How frequently are you urinating?
Like twice an hour.
Oh, that's a lot of water, huh?
Yes.
Yes. So what's the color of your urine?
It's like clear, slight yellow.
Okay. And is there any weird odor?
No.
What about sediment?
No.
Good to hear.
Yes.
We are good. So now I'm going to assess your temperature.
Okay.
I'm going to assess it bilaterally
Okay.
on your extremities. If you
Okay.
could please uncross your legs. Your arms and your hands, your legs, and your feet. Arms, legs, hands, and feet are all warm and equal in temperature. Now I am going to assess for capillary refill in all 10 fingers and toes, and I'm going to do so bilaterally.
Okay.
Wonderful, Miss Jansen. Your capillary refill is normal in less than 3 seconds.
Cool.
So now I am going to look for edema in your face, lower extremities. She is without edema, which is wonderful.
Okay.
And your neck veins look, I'm so sorry. Your neck looks good. There's no jugular vein distension. I'm now going to palpate your carotid arteries.
Okay.
Oh, that's a strong pulse. Great. Now I'm going to listen to them
Okay.
with the bell of my stethoscope. If you could please hold your breath while I do this.
Okay.
Great. Wonderful. Your carotid arteries sound good. This pulse strength is 2+ in normal, no bruise.
Okay.
So now I'm going to assess your other pulses. So your radial first. I'm going to do so bilaterally. Thank you.
Mm-hmm.
Radial pulse is 2+ in normal. Now your posterior tibial. 2+ in normal. Dorsalis pedis is 2+ and normal.
Cool.
Now I'm going to assess for skin turgor.
Okay.
I'm just going to pinch your hand lightly, okay?
Okay.
Your skin is very elastic.
Cool.
We've already established you drink a lot of water,
Yeah.
so that's great. You're nice and hydrated. There's no sign of tinting or diaphoresis.
Okay.
Now I'm going to assess your overall skin integrity.
Okay.
Anteriorly, her skin is intact. There's no sign of breakdown.
Okay.
If you could please flip over. Posteriorly, your skin is intact. No signs of breakdown.
Okay.
Looking good, Miss Jansen. Your overall pigmentation is consistent throughout the body and is normal for your race. There's no sign of cyanosis, jaundice, erythema, or flushing. You're
Cool.
doing great today. I would love to look at your fingernails now. Beautiful fingernails.
Thanks.
Your fingernails and toenails are all smooth. They're all translucent. They're
Cool.
consistent with color and thickness.
Nice.
Yeah, that's just so nice. Your oral mucosa, I think I need to look at that one more time just to make sure nothing's changed, okay? Do you say, beautiful. All mucous membranes are pink and moist. You are looking good.
Cool.
So I think we have gotten it all, and it's time for a musculoskeletal assessment.
Okay.
Okay?
Cool.
Cool. If you could please come to the edge of the bed here.
Okay.
Wonderful. Now I'm going to test muscle strength.
Okay.
If you could please resist, shrug your shoulders. Wonderful. And now put your arms up like this and resist against me. push, pull, squeeze inward,
Okay.
squeeze my fingers.
Okay.
Wonderful. Push up. Great. Push back. Push forward. And push up with your feet. Wonderful. Your muscles are so strong. So now I'm going to assess your sitting balance.
Okay.
If you could please close your eyes. I'm here just in case you need to sway. Wonderful. Your sitting balance is great. If you could please stand up for me, I am now going to assess your range of motion after I do your Romberg, standing Romberg.
Okay.
Please close your eyes, and I'm here if you need to grab onto me.
Okay.
Wonderful. You can open your eyes now. Your Romberg has a negative result. Your balance is good.
Cool.
You have great posture. Now I'm going to do range of motion.
Okay.
So I'd like you, let's come over here so we can make sure everyone can see your wonderful range of motion. Can you please roll your shoulders? And this is testing cranial nerve 11.
Okay.
Okay, we're going to roll our wrists. We're going to roll our ankles. Other ankle. And now please bend your knee up and move outward. So your knees and hips are looking good too. Wonderful. All of your joints are quiet, smooth, with no crepitus.
Okay.
And also your extremities, they moved very smoothly.
Good.
All movements have been controlled.
Okay.
Now, could you please walk toward the desk for me? I'm going to assess your gait.
Okay.
That gait is so smooth and normal.
Cool.
You did great today, Miss
Thank
Jansen,
you.
and I appreciate